So good morning, everybody, and thank you for being here in this community chat of Montefiore Nyack. I'm Sandra Arevalo. I'm the Director of Community Health and Wellness. I'm your host for Community Chat. And today we're going to be talking about the cost of cancer care and how to navigate that cost. That can be pretty expensive, especially, chronic conditions and treatments and medications and cost of care, patient care, all of that going to start adding up. And sometimes we don't even know what to do with that. So because of that reason, we have to invite our expert for the day, Samuel Hernandez. Thank you, Samuel, for being here. And Samuel Hernandez is from CSC, is Cancer Service Community Services. Okay. And he's going to be talking to us about this and also about all the things that they do in this great organization. I actually just came acquainted with them. When did we meet? I believe from last year or something, not too long ago. And it's really amazing, all the services that they provide to help people with cancer. But he's the expert. He'll tell you more about what the organization does and himself. So Samuel, thank you so much for being here and welcome. And we're looking forward to hear from you.
Yeah. So hello, everyone. Thanks for having me, Sandra. So I'm here from Cancer Support Community. We've been around since 2001, providing free social and emotional support to anyone who's been impacted by cancer. So it can be the person in treatment, but also family members, caregivers, and anyone who's lost someone to cancer. We provide support groups that are weekly. We have individual counseling, we have educational programming like this one, and we have different healthy lifestyle programming such as yoga, Reiki, Zumba. All of our programming does either have a virtual or in-person component. So if you'd like to, you can always come to our White Plains location. If not, you can connect with us virtually. And all of our support groups are currently virtual as well. And so, as I mentioned, all of our services are free. We don't ask for health insurance. We're really here to just support people as they navigate this difficult cancer journey.
Beautiful. So, Samuel, I know you have a recording that you want to show us. So just let me know, how do you want to get this started? Do you want to start showing the recording?
Yes. So let me just get this set up. I will share my screen and see. I'm just looking for it. It should be just right here. There it is. Okay, so I'll be sharing my screen for our presentation today. Let me know when
we did it. We're seeing your screen right now. Yeah, you probably just want to expand it. Perfect.
And when we did it earlier, the sound worked. So if for whatever reason it doesn't, just let me know.
Yeah,
and I'll be starting it now.
So thank you so much. And again,
hello, welcome everyone to our Frankly.
Oh, sorry.
No. Just a reminder to start writing your questions, and I'm going to be obviously reading all of your questions to Samuel at the end of the presentation. Thank you.
Great. And so if we're ready, I will be starting the presentation. If for whatever reason the sound isn't working, just let me know and I'll figure it out. Great.
Speaking about cancer program, today we'll be talking about how to cope with the cost of care. My name is Samuel Hernandez, and I'm a bilingual oncology social worker here at Cancer Support Community, Greater New York and Connecticut. Our mission is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. Just a little information about the medical information presented here. It was reviewed by Christina Bach in 2021. It's always important to get the most up-to-date medical information from your medical providers and the most up-to-date insurance information from insurance navigators. Some workshop disclosures. This program was developed by Cancer Support Community. We developed the content independently and then had outside medical and psychosocial experts review it. CSC has final control over the content of our own programs. This presenter, me, was engaged by Cancer Support Community, Greater New York and Connecticut. We'll start with our agenda. So we have our introductions, which I've just gone over. We'll then talk generally about health insurance, moving into more specifics about Medicare and Medicaid. We'll then segue into how to obtain prescription medications and some barriers to obtaining them. Talking next about employment and disability. And finally, we will review income and the challenges of managing medical debt. And then at the end, we'll have some time for questions and answers. Just to start with something that we all already know, cancer care is expensive. Many individuals may be getting their health insurance through their spouse's work, through their parents' insurance from different providers. For those who cannot, there are other options to obtaining health insurance, and I'll be sharing that information as well. It's helpful to know that health insurance usually doesn't cover everything. In a survey done by CSC, nearly 70% of respondents acknowledged some unexpected expenses during cancer treatment. On top of all that, talking about money can be difficult, and it's something that most people want to avoid. Your healthcare team isn't going to raise the issue, either because of the discomfort or because they simply don't know. Understanding your own options is important. If you take an empowerment approach toward the cost of your own care, it can help you to avoid financial toxicity and improve your ability to stick with your treatment plan and improve your quality of life. Now we're just going to talk about health insurance generally. What is it generally? How does it provide me with support and care? What are some types of health insurance? Here are some examples. I'm not going to discuss all of them. We will talk about some of them as we go through this presentation, but I'm putting this slide up so people generally have an idea of the different types that are available, as well as including a link to www.healthcare.gov and a phone number, which you can use to access different health insurance plans. What's important to know about these private insurance options? They may all have differences that will impact your ability to access care, whether that's in a group versus individual policy, either one negotiated on your behalf by an employer or one you've directly obtained for yourself. Each of these plans then may have different ways of operating. And I've also included the different types that you have here, the HMO, POS, PPO, EPO. What's also important to know is that when you get the details for your plan, you do have to read through the plan. You do have options, so you can compare. You can always compare and decide for your family what might impact your care and how it might impact your care. Ways that you can look for different insurance or through the healthcare marketplace, which I've already shared. You may be eligible for Medicare, Medicaid, other different veterans benefits, or you can privately purchase a plan directly. Things that you definitely want to look out for are your premiums. What is it going to cost me every month? The deductibles and co-payments. How much is it going to cost me per service, and what is the limit that I need to hit so that I don't have to pay that anymore? Co-insurance, cost share amounts. So many people may have multiple options for coverage, and you want to know which of these plans that you're considering might be able to share that cost a little bit better. Make sure that your current providers, your healthcare facilities, your pharmacies are all included in the plan if you'd like to keep working with them. Another thing to consider is that health insurance companies will have a list of different covered drugs, which is their formulary, which you should be able to access. And that is something that you want to consider when you're thinking about changing plans or you're just looking around at the other plans. This is just a general overview of what a health insurance card may look like. Everybody has a different one. It may look slightly stylistically different. You'll notice on the front of the page, you do have health insurance information, the name, the type of the policy, HMO, POS, PPO, and a phone number to call with additional questions. It'll also include your own personal information, which you'll need to know, including the ID number. If you're in a group, it will have that group information as well. On the back, you'll have additional resources such as mental health resources, substance abuse resources, your pharmaceutical resources, preferred providers, and who to call for claims and correspondences. So some important tips just for optimizing your health insurance coverage. You should know if your insurance company requires pre-authorization before care. That is something that you should always be trying to look out for, something that is really important to connect with. If you have multiple plans, you have to make sure that medical providers are sending the bills to the multiple insurance providers, especially in clinical settings where the medical care and the payment are in different departments. It may be helpful to know who the contacts are. Review your bills for any potential mistakes. Always review your bills. You'll be receiving an explanation of benefits from your insurance company, and you want to compare that to bills from your provider to see if there's any discrepancies or to make sure that everything is being covered. One other thing that you can always do is to request an insurance case manager. This should be a person who can assist you every single time that you call with every claim that you're making. If you're not given a case manager, make sure to note who you're talking to and request that person who you are talking to each time. This is mainly for your sanity. And so in order for you to make sure that you're talking to the same person, you don't have to repeat yourself. It is an ask that you can make. One thing that I'll be repeating a lot is keeping records. Make sure they're accurate, as much information as you need. More information is always better, including notes for each of your phone calls that'll have the date and time, the names that you spoke to, the persons, all the information that was discussed, any case number that's associated with the call, anything that's decided upon. If there's a pre-authorization or something that is told to you that will be covered, you want to make sure to jot that down as well. Some insurance companies also do record calls for training purposes. If you are interested in recording that call for your own records, just make sure that you ask for permission first. Some more tips: you can appeal a denial of coverage or any question if you're reviewing the bill and you want to know why something wasn't covered, why you paid for something. You're always able to ask that question. Make sure you're involving your provider who ordered the test. They will be able to provide the medical justification. And in any appeal in which you are asking for a reduction in cost or payment, they may need to provide additional documentation. There may be external or independent medical review that you can also request as well, just to get that additional support. Make sure that you keep all copies of denial letters with the specific reason the claim was denied. Again, this is really just keep records. All of the appeals will have deadlines. You want to make sure that everything is submitted in a timely manner. And always have on you a copy of your current insurance policy or benefit plan. The takeaway from all of this to optimize your health insurance is to keep careful notes. There may be someone on staff as part of your medical team who would be able to assist you in this process. They may have somebody who is knowledgeable on navigating these appeals claims. If you are on an employer-based plan, you may want to also let HR know that you've received a denial for care, and they may have some expertise helping you there as well. There's state insurance agencies and consumer assistance programs that you can contact. Things that are often denied, it's because they were not pre-approved or pre-authorized. And so that's why it's really important to make sure that you're doing this before any procedure. So let's talk a little bit about COBRA. That's a federal law that allows you to temporarily continue your employer-based health insurance. Some things to know: you will pay the full premium. It may be costly. There may be better options on the marketplace. This is a website the Department of Labor has that just shares your additional protections. You may be eligible for COBRA if you have an employer-based health insurance and you leave your job, you're laid off, you have your work hours reduced. If you have coverage through a loved one who becomes eligible for Medicaid, dies, or you separate or divorce, any way in which you may be potentially losing that coverage, or if you're aging out of a parent's plan. Depending on that qualifying event, COBRA coverage can last from 18 to 36 months. Again, premiums can be expensive. You are paying out of pocket now for the whole thing. There may be some financial assistance programs which would be able to help you with COBRA. With COBRA, your status remains the same. So if you have hit your deductible for the year, that remains in place. That's something to consider. When you are switching plans, it does not reset your deductible, and you will need to check the details of your new plan. You have 60 days to elect COBRA coverage. Your premiums must be made in a timely manner, so you do have to pay that monthly cost. If the employer ceases group health coverage, so if your employer essentially decides to end their own health insurance coverage, your own COBRA will end. If you become eligible for Medicare, your COBRA will end as well. Another thing to consider before we move on to the next slide is that if you elect for COBRA, you have to stay with that for the duration of the plan. So if you have elected to stay with it for 18 months or whatever your extended coverage is, you do have to remain for that. If you determine that it's too costly for you, that is not an eligible that is not a qualifying event in which it allows you to get off of that COBRA. The only times you can do it are for open enrollment, which is typically in November and December, or if you reach the end of your COBRA extension. Who does not have to offer COBRA? Which is just the federal government doesn't, certain church-related organizations, and employers who do not have 20 or more employees for at least 50% of the year. Some options when COBRA ends, things to think about. Again, you're comparing plans for yourself and your family. If it's available, the easiest option may be to just move to a family member's plan. Otherwise, the healthcare.gov website is great for looking for different plans that you might want to purchase for yourself. Some states do offer conversion of that plan. If you become eligible for Medicare or Medicaid, which we'll talk about in a little bit, that is another option. So let's talk about a little bit about patient protections and the Affordable Care Act. This is also known as Obamacare, colloquially. Most people now call it the Affordable Care Act. Some things that changed under that is that no pre-existing condition, there were no pre-existing condition exclusions or denials based off those pre-existing conditions, can't be charged more because of a current or past medical condition, and also extended the period in which adult children can remain on their parents' plan. Prohibited insurers from rescinding coverage, except if fraud has occurred. Also eliminated any lifetime limits or annual limits on essential health benefits. And there was mostly free preventative care for most private plans, which is again available on healthcare.gov. Some additional ways that people were able to get health insurance coverage. So Medicaid was expanded. They did change it to 138% of the federal poverty line, not looking at any asset or resource requirement. And then there are some state health insurance plans and marketplaces, especially in New York State here, that can be looked at that may have more beneficial plan than private plans. Oops. Okay, now we will talk a little bit about Medicaid versus Medicare. Medicaid is the federal health insurance for low-income individuals who meet that eligibility criteria that we just talked about. It is funded by both the federal and the state governments. Some individuals can have both. And so Medicaid.gov really is the resource for finding out if this is the correct plan for you. Medicare is a federal health care insurance for any citizen over 65 and over. Individuals who are receiving Social Security disability insurance benefits for at least 24 months. And some other individuals, such as those entitled to railroad benefits, those with end-stage renal disease, and those with ALS. Again, it's Medicare.gov for this one, Medicaid.gov for the previous one. Fee-for-service Medicare, we'll talk a little bit about that and what the different plans might. Medicaid Part A covers it's free for most Medicare beneficiaries and covers inpatient care. It's really important to know that Part B covers outpatient care, which includes outpatient chemo, radiation, labs, radiology procedures, and some parts of home care and hospice. If you don't elect Part B when you're first eligible, there actually is a penalty for later enrollment, and you can only enroll with new coverage beginning on July 1st, whenever that could be occurring. So there might be a gap if you don't elect for Medicaid Part B until that July 1st, in which you will not be receiving coverage. Just a reminder that Medicare does pay 80% of the cost, and the other 20% is covered by the patient. Most people will elect for a Medigap supplemental plan that they will add on to their Medicare. So we have Medicaid Part A, Medicaid Part B, and then Medicaid Part C, also known as Medicare Advantage plans. What are these? Essentially, this is when it's managed by a network of providers versus the federal government, and it creates some key differences between Part A and Part B. It's hard to get out of once you're in. There's a high deductible, and you cannot combine it with a stopgap plan. Who is this useful for? So it's useful for anyone who wants one company managing all of their care, plus additional dental, vision, gym benefits, etc., all the benefits that might come with a traditional health insurance plan. It's challenging for most folks in cancer care because it severely limits their ability to seek outside care. You may be locked into a particular network for your cancer care. It's really important to read the fine print. The plans may vary by state, but this is essentially the details for Medicare Part C. Medicare Part D, that's the prescription coverage. We have different plans in each state. It's again, you have to enroll. It's not automatic, so there will be a penalty if you don't enroll automatically, just like with the previous one. 2025, interestingly enough, will introduce a spending cap of $2,000, and I've included information here just to show how many enrollees have been spending more than $2,000 for their out-of-pocket prescription drugs. So this is important to think about because you may have, again, the formulary, which is just a list of information for all the different drugs that you may be taking. When you're moving into treatment, things that you do know that you need to be covered. There will be now in 2025 a cap. So something to consider for Medicaid Part D. Now we move into obtaining prescription medication. So we talked a little bit about it with Medicare Part D. Now we'll move into insurance coverage for pharmaceuticals and the different methods for obtaining medication. Most plans will include a prescription drug benefit. Oftentimes it is managed by another company. There will be rules about which pharmacies you can use, which are in network, or how you order prescription drugs through the mail. There will be a different number to call than your insurance provider. It's on the card. It should be on the back with other information. As with speaking to your insurance provider, it's really important to keep careful notes. What is a formulary? We talked a little bit about this. So each plan has a formulary or list of approved medication. One thing to consider is it's not set in stone. It could change at any time. Each plan, too, will have a different list of approved medication. Formulary medication usually does not require a pre-authorization. So that's one of the benefits to knowing what's actually on that list. Each insurance company, not the physicians, will be determining what's on their own formulary. If your provider is providing a non-formulary medication, it's really important to see if there is a formulary equivalent. This can be done in conjunction with your doctor, making sure that you're consulting them to making sure that that is an option available to you. If not, your healthcare provider can request special formulary coverage from your insurance company. There may be step therapy, which is in most cases, if you do not have treatment success or have terrible side effects with a lower step drug, you'll be moved up to the rung to the next step. This often also occurs with pain medication. As with insurance, you can appeal your denials. This is an alternative that is helpful. There are other ones on the internet, but we're sort of sharing what MediMeds looks like. It is a program that allows you to buy discount drugs. So if your drug is on there, if it's not covered by health insurance, it may be helpful for you to look at this website. There are plenty of others that you can also find online. Now we'll talk about employment and disability, how to navigate continued employment and the impact of disability. Of course, everybody is different and handles treatment differently. Some people may choose to continue to work. Some people may take that time off with goals to come back, or some may just indefinitely take leave. It's your decision and your decision how much you want to share about your medical condition. Also important to talk to your healthcare team about any medical certifications that you may need and any other types of disability insurance that you may qualify for. First, when you're considering making this decision, think to yourself, do I enjoy work? Is it a welcome or rewarding distraction? On top of that, what's being recommended to me? Can I even complete my work while I'm in treatment? It may be helpful at that point to talk to others who have gone through that experience, either with a similar diagnosis or a similar job, to see how the physical impact of their treatment was. And then finally, of course, what are the financial implications of taking time away? We all understand that not everything is a choice, and we may need to continue to work. And how can we mitigate that by making sure that we're protected in the workplace? One of those things that you can avail yourself of, whether you're the caregiver or the person in treatment, is the Family and Medical Leave Act. It can be used for medical leave or for care of a spouse, parent, or minor child. There are certain eligibility criteria that need to be met, namely, if you're the caregiver, how involved in the care will you be as determined by a medical provider. Some benefits of that: you get 12 work weeks of unpaid leave during any 12-month period, which means that it doesn't have to be consecutive. If you decide you want to take your days of chemo off, either as a caregiver or the person in treatment, you can take one Friday off, and that's protected. During this time, your job and health insurance benefits are protected. Some eligibility requirements. So not every employer has to provide FMLA. It's really those that are required. Is any employer with 50 plus employees within 75 miles of your work site? You have to have worked for 12 months, does not need to be consecutive, or worked for 1,200 hours approximately. And again, this is the Department of Labor website, which provides additional information about who is eligible for FMLA. Some people in treatment will also qualify for additional disability protections. And so this is the Americans with Disability Act, which protects against discrimination in the workplace. It protects employees and any job applicants as well. So it works for both of them. Allows for you to get the reasonable accommodations that you need in the workplace while having to not disclose any medical exams or any other treatment or diagnosis that you do have. In addition, most states will also have their own fair employment laws. And so here's some websites that can provide additional information about the ADA and how that can protect people who are disabled. We'll move on to Social Security Disability Insurance, commonly known as SSDI. And so what is it? It is a federal long-term disability insurance. We have the eligibility criteria, which can be found at ssa.gov, but it essentially is you've worked long enough and recently enough and paid into Social Security. So you do have to have worked to receive SSDI, and you have to have a medical condition that meets Social Security's definition of disability. So what is their definition of disability? While you're applying for it, there are some things that you will need. It can be done in person at your local office, over the phone, or on the internet. You will need your personal information, your Social Security number, birth certificate, names, addresses of treatment facilities and providers, dates of treatment, and names of all medications taken. So everything that sort of proves that you're going through this process and you are who you are. One thing that you can look at before you want to enter into this application process is the compassionate allowances. What is a compassionate allowance? It's really just the list of diseases and other medical conditions that meet the standards for disability benefits. It's found on the Social Security website. If you look up compassionate allowances on there, and I can share that information as well, then you'll find that there's just a list of all diseases that are currently qualifying to meet that standard. And so even before entering this process, if you want to know if it's worth it, you can look up your diagnosis on this website. If you're approved for SSDI, really important to know that this is only if you're not working. So if you're working, you're not eligible. And payments will start not 6 months after the diagnosis, but 6 months after you stop working. So that is when you begin to receive SSDI. It is based off of how much you have paid into the system over time. And if you're approved for SSDI, you get an additional 11 months of COBRA. So it's on top of whatever eligibility you previously had. After you receive these SSDI checks for 24 months, you then become eligible for Medicare. If you're not approved, there's various ways in which you can apply. Reconsideration, which is a per state basis. You can go through an administrative law judge, an appeals council, or the federal court system. All of these are a little bit more involved, so it's really important to go through the website to make sure that you're connecting with somebody who can help you to make that approval, that appeal. If you are approved for appeal, the good news is that you do receive retroactive benefits. So then we also have our Federal Supplemental Security Insurance, SSI. And so this one is helpful to think about if you haven't worked enough. And so there is a cap on this one. It is an entitlement program. Again, there has to be a disability accompanying with it. You can receive both. And so that is really helpful. SSI does have a cap. SSDI can sort of supplement you to that point as well. Other types of disability insurance that may exist are private disability insurance. Your employer may have their own sponsored disability insurance, and then there are state and disability insurance programs as well. Finally, we'll talk a little bit about income and managing medical debt. Foremost, there may be community resources. And so it's really important to check to see if there are local programs or programs specifically for the cancer diagnosis that may be able to assist with finances. Some of them may be restricted to paying for certain things. Some of them may be in kind, which means that it may be a donation for gas, it may be a ride to treatment. It may be unrestricted, which is what you might want to be looking for to help with the additional unexpected expenses that are coming with your cancer diagnosis. And we also have this information for credit counseling, which may be able to find additional supports for you. You may be thinking to yourself that there's a lot to consider. There's so much going on. There's so many additional expenses. I just want somebody to do it. And when you're considering working with a financial advisor who would be the professional in that capacity to help you, we want to think about what are the professional's credentials. Of course, we do this in almost every space, right? We want to know where our doctor went to school. We want to know where our social worker, what are the credentials of our social worker. On top of that, really important, do they have experience working with individuals with cancer? That's a unique perspective that people need to have, and you want somebody who has done this before. Are they familiar with aspects of medical coverage, disability benefits, life insurance, reverse mortgages, something also to consider? And then how are his or her fees determined? Retirement funds, so another thing to consider. Again, all of this is just options. It's not advice that I am giving. I'm not a financial advisor in this capacity. I'm just letting you know that there are options available to you. Some employers do permit borrowing from the retirement fund, and that may also be dependent on what the retirement fund is. Unreimbursed medical bills do qualify as a hardship. But there will be a 10% early withdrawal penalty, and anything you withdraw counts as income tax. So things to consider. As always, if you're considering looking into your retirement fund, you should speak with a financial planner or a financial advisor, somebody who can walk you through what all the different intricacies will be. Most retirement plans do have a point person or consultant that you should also be able to talk to. Life insurance. If you have life insurance, you can take out a loan from your life insurance policy. So you can preserve a portion of that for your beneficiaries, but you may be able to take out a portion to help cover medical expenses. What is a viatical settlement is something that you may want to consider, which is taking out, it's the sale of your life insurance policy essentially for a cash payout, which is less than what the policy is worth. And so you may just need the money now. And that may help to cover the different benefits, the different bills that are accruing while you're in treatment. Again, highly recommend discussing with a financial planner or advisor. I'm not giving financial advice here, but mostly talking about the different options available. For anyone who's 62 years or older and needs that support and has their house as an asset, they can also use a reverse mortgage. We are borrowing against home equity for the duration of time in your home. You will have to participate in some third-party financial consulting required by HUD, the Housing and Urban Development Department. Managing medical debt is tough. There are resources available. Empowerment approach can help. What that means is making sure to speak up, ask how much things cost, ask for somebody who is an expert to help you in navigating appeals and navigating the insurance and navigating the medical care. The best time to start, if you haven't already, is to start now. Ask as many questions as you can about the cost. Do not feel embarrassed. Do not feel like you can't have these conversations. Some additional resources that we provide. We have our cancer support helpline, which is staffed by community navigators, which not only can provide you with options in the community, they might also be able to provide you with national options that might be a better fit. So it's just foundations that might be able to provide financial assistance based off your specific diagnosis. Their hours are Monday through Friday, 9 to 9, and then Saturday through Sunday, 9 to 5 p.m. When you're making those treatment decisions, I also want to highlight our Open to Options program. So you can contact the support hotline in any of those hours, and you'll speak to a helpline specialist who can then go through a list of specific questions for your doctor about your concerns or your medical team. If you don't know how to ask about the cost or the expenses related to your care or treatment, Open to Options is a wonderful opportunity, not only to get some insight into how others might be doing it, how people have coached people endlessly, but also to get that additional practice. We offer other Frankly Speaking About Cancer presentations on a variety of topics important to people infected by cancer. You can also find this information available through print and digital publications online and our in-person programs. Now we'll have some time for any questions or discussions. Thank you everyone for attending our Frankly Speaking presentation on coping with the cost of care. My name again is Samuel Hernandez. You can always contact us for additional information, and now I'll take some time for questions. Thank you.
So we're all set. Thank you everyone for listening to that presentation.
Yes, well, thank you so much. And now, please, as Samuel said, start writing your questions in the chat or Q&A, and he'll be happy to answer your question. Let me see. One question is, what is the website address for CSC?
So I didn't mention, but we are all actually part of a federal network. And so if you're looking for our local office, it's Cancer Support Community, NYCT.org, because we're covering New York and Connecticut. If you find yourself in a different part of the country or you're looking for resources in a different part of the country, you can also navigate to cancersupportcommunity.org, and that will connect you to local resources. It also includes our helpline information, which I provided in the slide deck, and then they have educational resources. And so this particular presentation, the PDF version, is actually available on our website. It's completely free, but there are other educational topics as well that you can access via the national network, which is cancersupportcommunity.org.
Mm-hmm. And Samuel, as I was listening to your presentation, I was thinking, you explained very well the different parts of Medicare and Medicaid, private insurance, COBRA, all of this. However, what I was thinking is most of the time, we get into a health insurance without thinking, oh, I'm going to have cancer. Let me see what's the best choice for me. Usually what we get diagnosed when we already have an insurance plan that might or might not be working for our new condition. If that's the case, and my insurance is not working very well for me, how can I change, or how can I apply for Medicare or Medicaid or something that is going to help me cause the cover of cancer better?
Yeah, of course. And so that is something that we do find a lot, whether it's somebody who is not connecting with the oncologist that they are assigned to via their health insurance that they have to go to. And so it really is about looking for that qualifying event. Did you lose your job? Are you not working? Is something occurring that is allowing you to change your health insurance coverage? Healthcare.gov will provide you with the different plans that you may qualify for, in addition to, if you are continuing to work, what your income level will require your premium to be. If you're below a certain income level, you may qualify for free health insurance. So if you don't have that qualifying event, you have to wait for open enrollment, which will be starting in November every year. And so that's something to consider too. If you are not around that time, are you going to interrupt your treatment because you may want to change? It may be better at that point to just add on a supplemental option that may be able to provide you with an additional coverage. So it does get a little more complicated, I think, when you would like to change your health insurance, or you do feel like the treatment you're providing as covered by your health insurance is not what you want.
So can doctors or someone in the healthcare system help you navigate that so that I don't have to wait till October, November? Let's say, I get diagnosed in January, and now, of course, I don't want to delay my treatment 11 months, until I make sure my insurance is going to pay for my treatment. So can doctors help you with that? Like, will be a diagnosis of cancer considered an event serious enough to give you that opportunity to change your insurance coverage?
Yeah, so there may be a couple options in that particular instance. And so as I mentioned, if it's not being approved by your current insurance, it's always important to appeal, right? And that's where that will come in handy, to find a health insurance case manager in the particular insurance company that can help you to navigate that appeal. One other thing that doctors can do is create notes of special necessity. And so that may be an instance where either they will help you to get that treatment under your particular coverage, or you can then use that information that you're getting from your doctor to make a case for finding a different or alternate health insurance.
Mhm. Thank you. And we have another question here. I think it's somehow related. When the provider ignores alternate coverage providers and persist in billing Medicare, what are my options?
I will say, I think that for most people, the insurance process is frustrating. And oftentimes it is really about finding the correct person to talk to, whether or not that is an insurance case manager who can provide you with that additional support. Every situation is unique. I would say too, in that medical situation, I don't know if maybe you're talking to the wrong person, and that's just because they don't know how to navigate it. They're shutting that conversation down. And so trying to find somebody either by escalation or through just asking more questions and trying to get through that barrier, right? Because they're going to do whatever is easiest for them. And so trying to connect with a and health insurance navigator on site in the office, or just going through the insurance company is probably the best bet. And so you have this supplemental or alternate coverage. So contacting that health insurance company, letting them know what is happening, letting them know that it's not being covered, checking the details of your plan to make sure that they are able to cover that additional percentage or cover that portion of it, and then getting everything in writing and then going back to the provider at that point to make sure that it's being billed correctly. And if it is really one person that's holding it up, asking to work with a different person. If there's somebody else available who can navigate that process for you, making sure that you're not letting that roadblock prevent you from getting full coverage or that additional coverage from a different provider.
Is there any specific department in insurance companies that you should be talking to? I'm asking this question because, I find myself sometimes calling insurance companies, and you call an 800 number, it's automated, all the answers, and it's like you just talk to somebody who answers as well as the robot you were talking just now, and they just don't have any information for you, and it's so frustrating.
So in this situation too, especially when you have a chronic condition such as cancer, that's going to require treatment for months and potentially for years, it's really important to, as I previously mentioned, take notes, but also ask for a health insurance case manager. A case manager will be somebody assigned to you so that every time you connect, you're talking to the same person. If for whatever reason your health insurance does not provide that person, take the name and information of anyone who is helpful to you, even if it's the first person you talk to, and then you can request to work with that person. So when you call them again and you get somebody who's just automatically connected, you can say, I was working with this person previously. Here's my reference number and my case number. Please connect me to that person because I'd like to not repeat myself. I'd like to not have to go over the details again. And most times, if there's no case manager and they're working, you can then be connected to that person or receive a call back when they're available to connect with you.
Yeah, thank you for that wonderful advice. I think that could really make a difference. So to all of our attendees today, thank you so much for being here. Obviously to you too, Samuel, thank you so much for all this great information. I have, I think, 3 take-home messages. One is choose your insurance wisely. Second, always look for the help of a case manager, and write the name and number and reference number of the people you've been talking to when you are trying to get somewhere. I think that those are very important take-home messages. And, hopefully other people who were listening and will listen to this recording in the future will have more take-home messages from this great presentation. So thank you so much, Samuel. And I believe we're going to be still with cancer support community. Did I say it right this time? Okay, good. Next week, more on cancer treatment. So thank you so much to all of you, and I will see you next week.